Good afternoon, everyone. My name is David Wilds, and today I'd like to talk to you about BPD, bronchopulmonary dysplasia. Bronchopulmonary dysplasia involves abnormal development of lung tissue. It is often categorized as inflammation or scarring of the lung tissue. It develops often in premature babies who were born 10 weeks before their due date or earlier, or in newborn babies which are forced to use a mechanical ventilator to force oxygen into their lungs. Bronchial refers to the airways in which the oxygen we breathe is transferred to their lungs. Pulmonary refers to the lung and the air sacs inside the lung, which the oxygen and the carbon dioxide are exchanged. Dysplasia means abnormal changes in the development of lungs of a group of cells. It is estimated that between 5 and 10,000 children a year are diagnosed with bronchopulmonary dysplasia. Most of these children go on to live the life with no side effects or no lasting effects of BPD, but in some cases involved with other extreme infections or complications, BPD can be deadly. Babies who have BPD are greater risk of repeated respiratory infections. They often get pneumonia easier, bronchitis, RSV, and others. Most babies with BPD require that they go to neonatal intensive care, and the severity of the BPD, they can spend a couple weeks up to a couple months. When they are in a neonatal intensive care unit, they're often on a ventilator. They often have an NG tube, a feeding tube. They will have IVs to help give antibiotics. They will eventually be weaned off the ventilator to CPAP, to nasal cannula, and often sent home, very often with oxygen. I know our daughter was born 3.5 months before due date. She was 2 pounds in the neonatal intensive care unit for 72 days. She was on a ventilator, then a CPAP, then a nasal cannula. She had the NG tube. She had all the oxygen on monitors. When she went home, she was 4.5 pounds. We took her home with a pulsimeter monitor. We took her home with an apnea monitor, a heart monitor. We took her home with bottles of oxygen, an oxygen machine. We had to get her up every 3 hours and feed her. We had to put additives in her breast milk, which give extra calories because she requires more calories than a regular child because it's so hard for them breathing, it burns up more calories. My daughter was home just like most every other child with BPD. They give her bronchodilators, which in her case was albuterol to help expand the airways. Some children with BPD are given diuretics to keep the fluid from around their lungs. They are giving antibiotics to help stop any infection in their body. My daughter had an inhalant antibiotic, which was Pulmicort, that she took twice a day. And most of these children go on to live a normal life. My daughter, she survived, and today the only thing she has is asthma as a result of it. Precautions when you have a child is wash your hands all the time. Only take them out when they have to. If they got to go to the doctor, cover them up, take them to the doctor, don't be showing them off. It's most important that if anyone wants to come visit you, make sure they're not sick, make sure they've not been around anyone sick. Because the bottom line is, a small cold to me or you can mean hospital time to these children. And if you give them a cold, which turns into pneumonia, this could result in fatality for the child. So most importantly, make sure you keep these children safe inside, keep them away from anyone sick, and let them grow on to be healthy adults like us. Thank you.